Welcome back to For Your Best Self podcast. Dr. Novo. I'm here with Dr. Saluja in the studio. We are excited about this episode 6. The topic is events, and we have kind of 2 different spins on that. We're going to talk about safety in injectable events you might be participating in, what you should be looking out for. And then after the break, we're going to talk about event readiness and kind of a timeline that we have that's ideal to get you ready in a safe and planned manner. Now, I want this yesterday, or but
my wedding's next week.
Yes, right. Not a good idea. So we're going to talk about that after the break. So this is a topic that comes up a lot. You know, I want a Botox party at my house, or I went to this person's, you know, wherever and had filler. I don't know what it is. I didn't, you know, so we really try.
Yeah, there's no records, right?
We really, Dr. Saluja does a lot of corrections, and I, you know, see a lot of this. I'm not sure what was injected, and so we really like to have educated and informed patients, and we really want to help guide and establish basically a standard for how and where you're getting injectables done. So
yeah, I think injectables are fun, but that doesn't mean the injections themselves should be a party. You should get your injections so you can enjoy parties. But there's injections are medical procedures. Right. And I think thinking that they're anything less than that is not a good assumption.
Yeah, you kind of take away the feeling like people like to do it together. It's kind of a bonding experience, but you really want to be an informed consumer when you're having these procedures done. So one of our top things is you really should know who your injector is, really their qualifications, and make sure that they have an active license.
They should be
licensed.
They should be licensed. It should be an MD, DO, PA, or ARNP. Those are the 4 licenses that cover injections. And that's a bare minimum, right? And then it's experience. Who is behind that needle? Are they experienced? You can buy Botox and have a weekend course, or is this their specialty?
Or a dinner.
And their passion.
You can really go to a dinner and start injecting.
Yeah. Things can go wrong, so experience and licensure is important.
Definitely. And I think cleanliness is a big thing. We take multiple steps to make sure that the face is cleansed before any injectable. You know, we wear gloves. Now, disclaimer, we are wearing masks in this COVID era, so if we sound a little bit different, if you're listening and not watching, we are wearing surgical masks. So we do have the PPE that is relevant to the procedure that we're doing.
So 1, who's behind the needle. 2, sterile technique. I think it's really important for people to know that fillers are implants. So although they may be temporary implants, it's not really clear if all 100% of filler goes away or doesn't. Right. In fact, probably some percentage stays. And so it's an implant. And whenever we're putting an implant into the body, there's risk of infection, risk of occluding a vessel, and these things do happen. And so it's important to know what to do when they do happen, but also try to minimize their occurrence in the first place. So a clean face is really important. If people can come without makeup, super important. Should not be wearing makeup and getting injected. When patients do come to the office with makeup, it is the HIBA cleanser, it is alcohol, it is wiping until there is no makeup to be seen. And it is, on our end, the washing hands and gloves, or hand sanitizer and gloves. And then aftercare becomes important. It is keeping the face clean for the rest of the day.
And we've spent a lot of time really refining our pre and post care that we provide to patients, and make sure that they're educated and that we're available for questions.
One of the things that I find a lot of patients don't know is for fillers, the recommendation is to avoid dental procedures 2 weeks before and 2 weeks after. And that's something that is less well known, but important, because when there's work done in the mouth, you can have transient bacteria from the
Right.
mouth that find the increased nutrition around the filler as the filler's healing, and can create lumps or bumps or further problems. And so really knowing that this is not an urgent procedure, and there's
Timing
time to
it.
decide, time it right.
Right. And then we do emphasize minimizing alcohol. Alcohol can thin the blood. It affects your platelets. So if you are signing, you should have a consent for a procedure. And technically, if you're under the influence, consent is void. So you want to make sure that you're making informed consent, not under the influence, and then really minimizing the risk. Anytime you're having injectables, there's a risk of bleeding, bruising, and we don't want to exaggerate that risk by having alcohol on board.
Yeah, I think we really don't want Botox or filler remorse, right? So, I was drinking and I just
Under
said
the
yes.
influence,
That's really should be reserved for tattoos, but not injectables. So we want really sound mind, and when
Right.
you're having this conversation, I think that's important. And there are some events where we see, Botox and bubbles, or champagne and this, and have a little wine and treatment, and ideally 4 hours after.
Right.
Have your fun with your wine, but focus on your treatment first.
And then I think location is important too. We have a pretty strong stance of, only doing injectables where you have access to sterility, and then enough of the medication in case something unwanted would happen, like an occlusion. You have to have a certain amount of Hylenex or a medication specifically to dissolve the filler on hand. Expired.
Hylenex and Vitrace are called hyaluronidase medications, and they instantly dissolve Juvederm, Restylane, hyaluronic acid fillers. And then they also work a little bit more slowly over multiple days, but you use them in emergencies for instant dissolving of fillers to free up blood flow to the area. And timing is really critical in this scenario, that we want to, if there is a blood vessel that's being occluded, and you can tell that by pain and blanching, whiteness of the skin, and really significant pain. And so we want to dissolve the filler, free up the blood flow, repair that skin as soon as possible, and timing's key. And sometimes you need often more than one vial of Hylenex. So this is expensive medication. We may be using 5 or 10 vials at a time. And although it's rare to use, if you need it, and you need it now. And that's important.
I think too, a step that we take that should be done, this is a medical procedure, it's part of your record, is document lot numbers. Every filler should have a sticker, and that goes in the chart, and that is a way to, heaven forbid something to happen, but then you can trace it back to the maker of that product, and work that up, whatever they need to know if there was an error. So I think documentation is really important. It is frustrating when you're asked to fix something and it's like, oh, I don't know what was injected, and it's it makes it more challenging.
Sometimes patients don't know what was injected, and that's the benefit of having a record, is that we can get a request. But at events, often records are not kept, and records are legally required to be kept for 7 years. And we want to know what was used and where it was used. And it's understandable you may not remember, but your injector should know and have that documented. And when it's not documented, it becomes risky, not only that day, but over time, when you're getting future injections placed on top of that filler. There's some fillers that mix very well together. There's some that don't. And it's again, one of the things we believe in is safety. You can't prevent all risks or all complications, but you can at least minimize their occurrence. And then if they do occur, have a stepwise protocol to follow. And injectables are fun. but they are medical.
Yeah, and along the
procedures.
lines of being fun, we're not anti-Botox party. I mean, now with social distancing and small groups, it's not really realistic now, but we do host private events, and we try to make it special and kind of very attentive care and a good experience.
One of the signature events we've been hosting for years now is Best Skin Fridays. That's the first Friday of every month, and you can come with a friend. Lately, the friends have been in separate rooms, but traditionally we've allowed friends to share the experience with somebody and help with your jitters, but still do it in the safety of an office. It's a way to share promotions for people that like to kind of come on promotion day. It's a really nice celebratory day, but still having the safety involved. And I enjoy Best Skin Fridays. It's a nice way to meet friends of our patients.
See relationships. Yeah, it is exciting.
Yeah, and watch people encourage each other to do things for themselves.
Right.
To enhance themselves. Nice to see supportive friends.
Right, definitely. We're going to take a quick break, and when we get back, we're going to talk about our event countdown, kind of planning and how to be ready and the appropriate steps and what that timeline looks like.
All right. This is Doug Monda.
This is Karen Monda.
And Chris Hadaway.
And we're the host of Survive, the new podcast brought to you by the Survive First Foundation, a nonprofit organization assisting first responders and their families in need of mental health support due to the lifestyle of being a first responder. So, Chris, tell us what we're going to have.
We're coming to you from retired and active law enforcement officers as well as their spouses to discuss the responder life.
Don't forget, this is an unedited and raw podcast, so we need your interactive suggestions and advice to help us help others.
So find us live on our Survive First Facebook page and join in the conversation, or find us on demand on Spotify, iTunes, or anywhere you listen to podcasts from the Space Coast Podcast Network to you.
Hey guys, I'm Steve Vitani, Brevard resident and realtor with RE/MAX Elite. I'm excited to announce my new very own podcast show, Steve Talks 321. We are on Facebook Live every Tuesday at 7 p.m. Eastern Time, talking about the most current real estate trends, hot topics, as well as anything along the Space Coast in Brevard County. I'm excited to share all of the latest happenings throughout Brevard County and also to hear from you. Please like this page, Steve Talks 321, and share this page and podcast with your friends. Thanks a lot. I hope to hear from you guys soon.
Welcome back to the For Your Best Self podcast. We have a great timeline that we want to share with you. It is available on our website, foryourbestself.com. And we really developed this by pretty much demand from patients. Kind of a recurring theme was, how do I prepare for this big wedding, or, I'm a guest, or a major life event. And it doesn't even have to be an event. It could just be, how much time does it take to prepare and take all these
like
steps to be my best self.
Reunions or big birthdays.
Yeah. So we start out, ideally 9 to 12 months out, you want to start thinking and planning. It's an investment, and you're going to want to make sure that you have time to prepare. So the reason why we'd say 9 months is if you're thinking about changing something surgically, you really need time for consultation, and then time for planning and being on the surgery schedule, and then recovering. Most procedures you're fully recovered within 6 weeks, but we want to make sure that you have no restrictions for that special event.
What are the common plastic surgery procedures people are asking for before
definitely
weddings or reunions.
top to bottom, head to toe, really. It could be eyelids, face. Usually they want to look and feel their best for their family or their children, or they want to show up, looking just totally refreshed. Breasts, tummy.
Oh, so
head to toe.
anything, yes.
Yeah, they want to fit in that dress, or arms, show. So really a little bit of everything. And then, so once you've thought about that, if plastic surgery is even on your radar, it's not that you need plastic surgery for your event, but if you're thinking about it, you want to start about 9 to 12 months in advance. And then we're going to really introduce you into skincare at about 4 to 5 months. That lets us really optimize your plan. Skincare might be prepping you for other things as well, and it just builds a relationship and consistency. So we can see a lot of changes in 6 to 8 weeks in a really good skincare regimen. So you want to start introducing that about 4 months out from your
event.
That
allows good results from skincare, and then also modification of the plan if there's any irritation.
And we can develop all that in our office with our educators or our estheticians. We pretty much touch on skincare in every office visit.
Yeah, one of the really popular skincare regimens 4 months out is the Obagi New Derm Transformation System, because you can literally transform your skin, and a kit lasts about 4 months.
Right.
So it's a great timeline for the Obagi New Derm kit. And Obagi has this neat thing online where you can follow along every week. You sign up for their email, and every week they'll tell you what's happening to your skin, so you can understand the science about it. And I think if your mind or brain's on board, then your skin responds even better.
Right.
So knowing the why behind why you're doing these steps is impactful for your skin.
Yeah, New Derm Kit is a home run. If you have sun damage, sunspots, freckles, any discoloration or just texture, it's a home run.
It is.
Awesome. So then at about 3 months out, are you looking at consulting on some of your injectables or restructuring?
Yeah, I think 3 months is a great time to try Botox and fillers, including the Y-lift, because that way we can tweak how you like your Botox and just do a little touch-up before
I've had to say no to a bride a week before her wedding who wanted to try Botox for the first time. I was like, no,
you really want to get it in 3 months before if you can, so you can just adjust and tweak.
Good news is, it's temporary. Bad news is it's temporary. So I got to keep doing it, but you want to make sure the dosage and the look is perfect.
Yeah, and so when you're having a significant filler package where we're trying to enhance cheeks and jaws and jaw multiple things, then ideally 3 months out.
You want time to build on it. And that's usually when I'm doing resurfacing. Science has come so far in conjunction with skincare that our patients are really healed in a week with fractionated CO2, which is, and even some of my deeper chemical peels, which are the most powerful skin resets you can do. You can be healed within a week, but then you're going to be red and maybe a little bit irritated. So we want to make sure you're doing this several months out so that you can really get the full benefit, the full collagen stimulation, as well as skin will be calm.
I think that with your laser resurfacing and using the regenerating nectar after, you really can't look at the pictures on Google after laser resurfacing. They're so outdated.
It is so different.
So outdated in how healing is these days.
It's really cut the healing experience and time down, I'd say, by 50% or greater. And plus the fractionated CO2s, the healing is faster, but even with the most aggressive, your skin is regenerated within about 5 to 7 days.
And that's great for wrinkles.
Phenomenal. Sun damage, wrinkles, smoothing, tightening. Yeah. Face, neck, back of hands.
Why would you do laser with you versus and us versus a med spa?
I think the setting, the experience, you alluded earlier to, you can't just be technically competent. You have to be able to deal with anything that could potentially go wrong. And luckily we see minimal go wrong, but I see and treat scars, surgical scars all day, every day. So I think that comfort level and, when to worry, when to change tact, and having different tools, it takes experience in a team. And I think just that
and I think like
clean
we were talking,
medical setting.
I think like how we were talking earlier that injectables are a medical procedure. We need to know your medical history.
Right.
So sometimes, at events or pre-event, if we're getting prepped, we need to know if you've had a history of cold sores or fever blisters prior, because this is something we medicate for. We need to know if your immune system is compromised, if you're on things like prednisone or medications for autoimmune conditions like lupus or Crohn's disease or ulcerative colitis, or things that may impact healing, diabetes, smoking, all those things are important to discuss with us. It's more than beautifying.
Right. Yep. We're dealing with the skin on multiple levels. So there's a lot that goes into the preparation of that. We will not do laser unless you're committed to skincare as well. So that's why laying that skincare foundation kind of prepares you for the layers. And you're going to get the best results from your injectables and your laser afterwards, and the best maintenance.
So let's say I'm in the 2-month range. Time escaped to me. I'm coming at 2 months.
Hope is not lost.
Okay.
We can still do plenty of things. So we're still going to work on the skin. We're going to look for less recovery time, things where there's, less healing. So we have we mentioned earlier, the hydrofacial. I think that is a home run at any time. That's, you could do that up to a few days before the procedure, dermaplaning.
Yeah, I really like those week of procedure for that event ready phase. It's, in the 2 months, will you consider IPL photofacials?
Yeah, IPL, XLV. We have great complexion lasers. Granted, they're not going to get wrinkle reduction and anti-aging. Those will take more healing time, but they're like an airbrush for the skin, so you can really reduce the makeup that you need. I think the most beautiful face is, just a smooth complexion with minimal makeup. So the XLV,
the XLV will take care of like if they have
broken capillaries, rosacea, some of those underlying redness, and IPL is good for brown spots. Granted, you should not have a tan for any of these, or spray tan for any of these procedures.
Yeah.
So the skin is clean.
For a lot of our brides, I feel like they start getting stress acne around this period. And so we do peels, chemical peels to help with the breakouts, and may even do a low dose doxycycline to get them through the event if they're breaking out. And we found that's been a lifesaver for a lot of the brides to be when they're starting to get that breakout.
That's a nice thing they can come in for. I love putting patients under the Saluma light just to kind of calm the skin and anti-inflammatory.
Do you use the Saluma red light after laser as well? Okay.
Yep, surgery. I like to give it to them after anything that's going to kind of speed up the healing, decrease inflammation, swelling.
That's very, very neat.
Yep. And then when would you do lips?
I would do lips as long as it's been ideally 4 to 6 weeks out, so that we have some time to again tweak if we need to. We can hydrate the lips, we can plump the lips, we can help with fine lines. There's different forms of Juvederm and Restylane, and we were just recently talking about the newest Restylane Kiss, and so I think lips are a nice thing to do 4 to 6 weeks before. I'm willing to try Botox 4 to 6 weeks before too, because there's some time, and that's really nice to smooth lines and wrinkles. I ask our patients not to get a frozen look with their Botox before events, because I think you want to have some expression, some crow's lines, some movement of your brows. I think that's very nice when you're at an event, that the goal is that people say you look wonderful and refreshed and happy and relaxed, versus, oh, she got her Botox for this event, or he got his Botox for this event. So I think a more natural toned down look for an event is really our goal.
This would be a great time for Aqua Gold too.
Yeah,
like
you
Aqua
like
Gold
it.
anytime.
Aqua Gold is our red carpet facial or a liquid gold facial that combines microneedling, Botox, filler in one procedure where we treat in microdoses throughout the whole face, so that again,
Dewy,
maintains-
hydrated. Nice.
Yeah, pretty skin.
Awesome. And then right before the event, you want to just have fresh skin. Love the hydrofacial. It's going to gently exfoliate and decongest the pores.
Yeah, and for those of you who are not sure what dermaplaning is that we do with the hydrofacial, that is where we take a special blade to remove the top layers of skin that are not living so that the living skin can glow below. It also takes some of the peach fuzz and some of the dullness away. And so we call it our Glow to Go facial treatment. And then, when it's, I'm just going to say it, one of my favorite parts of getting someone ready for an event is seeing their event photos when they come back, because almost everybody I know that we get ready for an event continues to do some portion of these treatments after the event because they enjoyed getting them, or they enjoyed the results, or they realize the importance of their health in this manner. And so seeing them after and seeing the photos from the events are actually a lot of fun.
Right. Looking good and feeling good really is a part of our confidence and how we carry ourselves. And, people's expression and demeanor change when you feel good about your skin and how your body moves and looks. And that's
I think those
awesome.
would be good photos for us to collect, actually.
Yeah.
Photos
Events.
from their events.
Yeah.
And they're looking their best.
Yes. That would be awesome. So
That
send
would
us
be fun.
once you've done your transformation.
Yeah, send us your photos to foryourbestself@gmail.com so we can share them. The
And
happiness.
Again, this isn't a checklist, but this is a timeline if you are considering any of these things, giving it appropriate recovery and thought and planning. And if you have any questions, you can schedule a consult. We'd love to be a part of your event readiness preparation. And it might be one of us, it might be both of us, it might be our estheticians, our educators, and we're all here for you and to help you achieve your goals. So check us out at foryourbestself.com or Instagram, Dr. Saluja _Dr. Novo, or continue subscribing and listening and sharing this podcast.